the question basically is, why is it that a lot of our patients come in, they've already had a recurrence of the cancer 2 or 3 times, and now they're coming to us, on the one hand, and the other hand is they felt when they were first diagnosed with whatever cancer it was, that they were, without having a chance to catch their breath, they were rushed into surgery and had body parts removed, and now here they are with the same cancer, and so it didn't work. And so, you know, what's going on there, and does that have to happen, is kind of the question I think is being presented. And we were talking before about how cancer starts out as one cell and then it doubles and doubles and doubles and doubles. That process of doubling until it gets to stage, what we call stage 1, which is detectable, right? A little lump in the breast, you know, a nodule on a prostate exam, something like that. Pancreatic cancer, unfortunately, you don't know until it's probably in at least a stage 2 or 3. That's one of the problems with pancreatic cancer. Brain tumors, things like that. But if you can find it, if it's a small lump, well, it didn't just pop up overnight. Even though you might think so, it's been around for anywhere from 5 to 7 to 8 years. Okay, it's been in process. So to jump into something next week is unnecessary. What is necessary at this point is for that person who's just got the most shocking news that they could imagine, whose entire agenda has now been suspended. You know, there's no way to comprehend what happens to a person when they hear this news. And it's at that time for that person to really start collecting, first of all, to go through the emotional acceptance of what's happening so that they can proceed in a way that's healthy for them. And the way they can do that is by collecting data. You know, I know for myself, if I've got a problem, the first thing I need to do is try to understand that problem. And I need to, you know, separate it into parts, and once I understand it, I can then work with it. And so if someone's diagnosed with cancer, they need to understand that what it is, what are the how it's treated, what are the common ways of treating it, what are the alternative ways of treating it, which one works better, what's the statistics on either way, or the data on either way, and what fits. What fits? Where do you feel comfortable at? Because if you go into a therapy that everyone tells you is the best and you just feel uneasy about it, that's going to affect you. What do we mean by that? Well, there is an axis, and I hate to digress, but I have to. There's an axis that goes from the brain through the hormones to affect the body. Okay, so it's called the neuroendocrine axis. And the example that's really clear is 2 women start working together, become friends at the office, and they find out that they're menstruating at the same time, or they move in as roommates and they start menstruating at the same time. They didn't talk about it and discuss it and say, you know, let's do that. It's something that happened because of the effect of the brain, the neuro part, on the endocrine system, which is the hormonal part. Okay, so if we understand that, we realize that the effect. So if we're walking around in fear and we don't have all the data and we're confused, all of that contributes to our body's inability to deal with this problem. And the body's main system that deals with cancer is the immune system. Okay, so the immune system gets downregulated, dysfunctional, the more confused and fearful that we are. So really it's important not to, for a doctor, not to sit there across from the patient and just point the finger and tell them they're going to die and give all these fearful images, and then they rush into surgery. I've had many women come in and who had 1 or 2 breasts removed and say, I guess I didn't have to do that, you know, and they're crying. It's a mourning because they've lost a body part, and it's true. They didn't have to. Now, I'm not saying they won't have to down the line. We don't know. Nobody knows the answer of the future. But you don't have to rush into it. It's not something you have to do today. It's today that you first found out you have a cancer somewhere in your body. It's time to Find out who you love, who's in your family, get together, and solve this problem. The problem I have seen, this problem called cancer, I have seen solved so many times through that gathering of information. I've got people who are, I'm like the fourth one, and they've got 3 more people they're going to visit, and they've flown into Arizona, and you know, so my hat is off to those people, because they are doing what they're supposed to do, their due diligence. You know, you would do your due diligence if you were going to purchase a new automobile. If you buy a pair of shoes, you're going to walk around in them. You're going to look at a few of them. You know, so we actually take the time because we're not in fear when we're purchasing other services and goods. Well, this is probably the most important service one would ever purchase, and so they really need to do their due diligence. So the reason I'm seeing people for the second and third time is because, the reason I'm seeing people who have had 2 to 3 recurrences before they come in is because the first and second time, out of fear, they rushed into therapies that they didn't think out correctly. And so now they're saying, wait a minute, this is not working. And so they come to us. And unfortunately, most people come to us at that stage, and it's a little harder to work with, but nevertheless, we have wonderful results with them as well. But it's certainly a lot easier, a lot quicker, and a lot less painful if one comes in at an earlier stage.